Many thanks, Gunda, for that background report. Let's introduce our guest now. Seated with us right here in the studio is Sarah Abagai, a registered dietitian, nutrition educator, author, and fellow, Institute for Dietetics in Nigeria. Many thanks for joining us, ma'am.
Thank you for having me. Good morning, viewers.
All right. Also joining us for the conversation board in our Maiduguri studio is Dr. Ibrahim Abubakar Gatimari, member American College of Physicians, fellow Medical College of Physicians, consultant physician and cardiologist at UMTH, and also a lecturer at University of Maiduguri. Many thanks for joining us, Doctor. Get to hear from him
All right.
in the course of the conversation.
Okay. While we get that cleared up, we have to begin from here in the studio. We're talking health. Just how important is diet or dieting to, good health? Speaking from your perspective as a dietitian.
Well, thank you very much. When we talk about lifestyle, food is the integral part of man's lifestyle. In the sense that what you eat generally impacts your health. And before the colonization of Africa, we were eating our natural plant-based foods. And everybody was the healthier for it at that time. We had no incidences of lifestyle-related diseases because the heart disease, diabetes, and the rest of them are all related to the lifestyle and essentially food, what we eat. Now, with the colonization, so many things began to change. Processed foods began to come in to the system. The foods robbed of their vital nutrients that will keep you healthy. Refined foods, foods loaded with sugar, loaded with salt, loaded with all manner of preservatives and additives came into the scene. And it was from then we began to see, morbidity in our society. We began to see, heart diseases. We began to see issues of diabetes, cancers, and the rest of them. So for the heart, diet is very essential. And it takes discipline for you to be able to, achieve heart health, as it were, in this generation that we're in. You have to be very intentional about sorting out to bring out what we call, the plant-based diet. We are going back to it again. Having suffered a lot of morbidity, mortality from heart disease and all. Recently, we've been having people just slumping and dying. I lost a friend, just 2 days ago. A Facebook friend, as it were, but very prominent person. And all of a sudden, he was in a meeting and he fell, slumped and died. So this has become very rampant. And it is because of the changes in lifestyle. Changes essentially in food. We have come into the issue of quick fixes in diet. We need quickly what we can open up and pour in a pan and eat, packaged food. We need, we go in for fast foods. In the outlets, they're all over the place, processed and fast foods. People just want to grab something and go. And so at the end of it, we are grabbing a lot of fat, a lot of sugar, a lot of salt, and all those additives.
All right. Many thanks for your opening comments, madam. But, some would also ask if the natural foods you're talking about, the plant-based diets, if they are also healthy, considering the kinds of fertilizers, the way the foods are stored these days, and of course, so many other issues in the chain before it gets to the table. So are they as healthy as they were in the past when we didn't use some of these chemicals and all of that? But I'm sure you will respond to that much later. Let's get to Dr. Abubakar now. I hope he can hear me. I'd like you to, explain what heart health means. Some people know that the heart is formed even before you were born. So what determines how healthy your heart is? Is it the state of the mother who conceives the baby? Or is it what you do after you were born? Doctor.
Heart health means a heart that has completely out of any disease ranging from concentric hypertrophy to heart failure and then other cardiovascular diseases. And then what healthy heart means, devoid a person who has no risk factor for cardiovascular disease. So such risk factors include hypertension. Anybody who has hypertension is at risk of developing cardiovascular disease and then subsequently maybe lead to heart failure. Diabetes, another risk factor. And then there are other risk factors which are actually due to our lifestyles, like cigarette smoking, excessive alcohol consumption, and then urbanization generally, which exposes us to psychological and physical stress. These all risk factors, and then other that we don't have control over them, which are non-modifiable, like our family history, genetic makeup that predisposes to heart disease and cardiovascular diseases, and then as well as an age. Aging is also a risk factor for cardiovascular disease, and be it male, gender is also, we don't have control over those risk factors that I just mentioned, but the rest, we can able to modify them by treating appropriately or preventing hypertension by controlling our lifestyle, and then by treating diabetes or preventing diabetes by treatment or by preventing them by lifestyle modifications and cessation of smoking and alcohol consumption, and then reduce salt intake. Salt is a major risk factor for hypertension in this environment. We take a lot of salt as black rays, so we need to cut down table salt intake, particularly sodium containing salt.
Dr. Galtimari, from your perspective still, what's your reading of the level of awareness that Nigerians have of all the things you have talked about, whether they are preventive or curative, or even just being aware of, what heart health entails?
If I get you correctly, many Nigerians are not aware of their health status, particularly heart health status, and then many Nigerians present to us within the hospital very late after those risk factors must have caused damage to the cardiovascular system or to the heart in general.
All right, many thanks, Doctor. There's an aspect of the first question I asked which I didn't quite get your response to, about the fact that there are children who are born with heart complications. So speak to us about that. The factors that could lead to a child or anyone being born with a heart condition that can be termed as unhealthy. That's on one hand. Then you talked about some health conditions that could worsen the state of your heart. Is there a way that the state of your heart can be picked? Let us know. I mean, for diabetes, a lot of people know the kind of tests they can take and all. Not many people are aware that you could get your heart screened. Speak about that too.
There are some young people who are born with heart diseases, which we called congenital heart disease. However, certain things are actually due to genetic deletion or genetic polymorphism. But in certain conditions, if the mother takes some drugs, can predispose the child, baby, in utero, to expose them to congenital heart diseases. But congenital heart disease generally comes due to genetic polymorphism or chromosomal diseases associated with, like Turner syndrome, Down syndrome are associated with cardiovascular diseases. And generally, for the screening of heart is done at the level of identifying the risk factors. When you measure your blood pressure and the blood pressure is high, then the subsequent examination of the heart, which include chest x-ray, could be done. But initial one is clinically when a physician or community family physicians when see patients and then determines that the blood pressure is high or the patient is diabetic, then subsequent screening for the health of the heart is done by requesting electrocardiography, ECG, chest x-ray to look at the size of the heart, and then to go ahead and do even echocardiography to determine the health, how healthy the heart is.
All right, Dr. Galtimari, thank you very much for your opening remarks. We'll get back to you in the course of this conversation. But back here in the studio, you've talked about, grab-and-go foods, fast foods, and all of that. And diet, of course, is said to be the first medicine. But in all of this, how much of the burden is borne by Nigerian foods or cooking practices that, may quietly damage the heart the most, even though, they are staples?
Come again?
I said, how much of the burden
Of
heart-related diseases is borne by Nigerian foods? We're not talking fast food now. How do you cook it? How you cook it? And even if they are staple foods, the mode of preparation and how you go about it.
Well, actually, when we talk about fiber in food, you find that fiber is not degradable. You understand? Because it is a very vital thing that you require to deal with the issue of blood glucose, being able to reduce or lower and stabilize blood glucose. You talk about the insoluble fiber which comes from the fruits and vegetables that we eat. They are not degradable. The only thing you might lose, and that one, from the fruits and vegetables is what helps to, lower cholesterol. It helps you, that fiber binds the cholesterol from the colon, from the intestine, and it passes it out with your feces. So that way it keeps reducing cholesterol, to save margins, to keep you healthy. What you essentially would lose in that case would be the vital micronutrients, vitamins and minerals. And then, of course, we are now talking about seasonings. We talk about bouillon cubes. When you sit and see mass cooking being done, you'll be afraid to eat in Nigeria today. Because yes, when they're cooking for maybe ceremonies, or if you go to restaurants that have, you know, large clientele or large customer base, you find that, you know, seasonings are opened, like bouillon cubes are piled in containers, and that is sodium based. So what are we talking about? It increases the risk for hypertension, and it increases the risk for heart disease.
There's powdered bouillon now, seasoning.
Yes.
So they don't even measure. They just
in the food. And then you also have the issue of frying, especially deep fat frying. You know, it has become the culture now, and the more you fry, and you find that you fry, it adds the calorie value to the diet, bringing results in the area of overweight. And you know, overweight is one risk factor to heart disease. Secondly, the kind of fat you find in pastries is saturated fats, largely trans fats. And with trans fats, you know, cholesterol becomes very, very common. Apart from, you know, the trans fats that you get from that, you also will look at how, you know, the frying changes the structure of the oil, releasing, you know, toxic metabolites such as free radicals. And all these are implicated in other diseases, lifestyle-related diseases like cancer and the rest of them. So frying, cooking with a lot of, you know, seasonings, salt. These days when you buy jollof rice, the moment you know, taste it, it's either full of bouillon cubes or it's full of salt or both. So you see, this is what is laying the foundation for heart disease all over the place. And everybody just relishes it, not understanding the implication. And when you look at also the issue of, you know, the things that go with these foods, the beverages, the carbonated drinks, and all, they are all sugar loaded. And by the time sugar is high in the system, it is also, you know, implicated in the, you know, the genesis of cholesterol, hyperlipidemia.
What about those that are zero sugar?
Zero sugar. They are simply aspartame. And aspartame has its own history, story too, when it comes to cancers.
energy drinks.
Wow. That is another one that can knock the heart. You understand? Because it actually increases the heart rate and, you know, can create a lot of problems.
What about all kinds of supplements flying around these days?
Well, supplements, you know, we talk about approaching supplements with a lot of caution. You need to read, you need to understand what really do you want before you go for a particular supplement.
All right, you know, you talked about food, and, you know, I was trying to talk about the fact that if you take, for example, yam, they're in season now, right? In the past, you could buy yams, and, I mean, they could stay for months without going bad. But these days, you buy yams, and in weeks, they're rotting already. That's on one hand. Secondly, there are certain foods in the past that you do not really need to season so much. They were as tasty as, I mean, as you would need it. But not these days. Some say it's the chemical. I'll give a simple example, egusi, for example. In the past, you could cook egusi with nothing. It would taste really nice. But these days, I mean, you could even taste the chemical in it as you eat. So speak to us about how our plants are being cultivated these days. The chemicals, or if you like, the fertilizers that are used in cultivating them, chemicals used in preserving. I mean, because you want to transport from the village to the city, you have to use all kinds of things to keep them fresh till, you know, they get to the market. How is that affecting our health?
Well, massively, very negatively, for that matter. You see, back in those days when things were done naturally, if you were to take these yams, they were just cultivated with no fertilizer, with nothing, and the storage system was also very good, airy, isn't it? So that the yams will not get into a place where they're a humid environment that will encourage them to begin to spoil. But these days, I guess because of the population explosion, we have now begun to devise methods of preserving foods, and we have gone into chemicals. I'll talk to you about grains. Back in those days, we had barns in the villages where when you harvested your guinea corn, your millet and everything, you first of all dry it, and then you pack and store them wholly in the barns. So each time they were to be used, you go fetch them, then you begin to process the husk, and then you get your grains. You didn't need any form of preservative agent for that. But when we began now to process instantly, after harvest and drying, just adequately, and then we begin to put them in sacks, and we store them in rooms, stores, and the humidity begins to affect them, and weevils now came into the picture. And that is what is now creating the situation for people to be looking for chemicals for preservation. So it's a new one on us now. Now, we are talking about clean, foods that you could fetch and cook. But now you have to be mindful of the issue of chemicals. We've heard people buy beans, buy cereals, and other things from the market, they ate, and the entire family died because of chemical, preservation on such food. Now, we are looking at the necessity of people beginning to learn that, look, when you buy something, unless it is directly from your farm, when you buy grains, you buy even proteins like, fish, fish, stockfish. You hear they're using sniper now to preserve stockfish and all that. It is important to give it thorough washing. Even your grains, we are now advising people, as long as you bought this thing from the market, there's no guarantee that there is no chemical, added to it. So please wash thoroughly and dry. That's the best we can do for now.
All right. Thank you, Sarah Bagai. Let me get back to Dr. Galtimari. Now, Doctor, we read that 7 out of 10 Nigerian adults live with one form of heart disease and another. What does this say about the state of our health, especially when you consider that there are just about 400 cardiologists in the country of about 202, in excess of 220 million people?
Generally, in Nigeria, there are shortage of doctors because of certain conditions that lead to a lot of doctors moving away from Nigeria. And then the training of cardiology involves very strenuous activity, very strenuous, and then you move from one center to the other to be trained. And when you train as a cardiologist, comparatively to other countries, the remuneration in this country is very low. People are moving away. Having said that, 7 out of 10 Nigerians, 70% of Nigerians adults age 40 and above are hypertensive, and they have one form of cardiovascular disease or the other. Hypertension can be treated, if not complicated. Uncomplicated hypertension can be managed at the level of family physician. Medical officer can manage hypertension because looking at the number of cardiologists in the country is very low looking at the population of the country. Still, we have physicians as well. Internal medicine physicians can able to manage hypertension. Family physicians can manage hypertension. Hypertensions that are uncomplicated, cardiovascular diseases that are uncomplicated. However, most of this risk factor, particularly hypertension, if is not appropriately managed, the patient will come down with cardiovascular disease, either in form of heart attack, myocardial infarction in our own terms as cardiologists, or they will come with stroke or heart failure. So which of these is costly to manage and associated with disability as well as mortality. And if it happens to a person and that person works, they will create a vacuum in that particular organization. So it's very costly in terms of management as well as it's very costly in terms of economic factor as well. So we are trying our best as cardiologists in Nigeria to cater for our patients. Here in UMTH, we see we have preventive clinic as well as other forms of clinic that we see all patients with cardiovascular disease with dedicated center that has been commissioned recently.
Let our viewers know that they can send in questions, comments, suggestions, whatever it is, as regards to the topic we're discussing. The number is on your screen. You can send either SMS or a WhatsApp message. Please do not call. Thank you. Doctor, I'd like to stay with you. We've talked about the causes, we've talked about the risk factors and all of that. Speak to us about some of the signs and symptoms. I mean, what should a healthy, I mean, a lot of people say healthy. I mean, in the papers this morning, we saw a case of the NSCDC commandant in Edo State who attended an event. Right there at the event, started to convulse and eventually passed on. I mean, from the reports, they said he came in looking very healthy and lively and happy. So are there really signs that could tell someone that, oh, you need to get your heart checked or there's something going wrong with your heart? Speak to us about that.
Thank you very much for this question. Actually, one of the risk factors is hypertension, and hypertension does not have a particular symptom for most of the cases. That's why we advise people that are age greater than 55 and women that are postmenopausal to be checking their blood pressure regularly. Having said that, there are certain symptoms that cardiovascular disease generally present with shortness of breath on exertion, on movement. A person cannot move to 6-minute walk without experiencing shortness of breath is a symptom of cardiovascular disease. The secondly is patient easily get fatigued, okay? And then thirdly, if a patient is experiencing chest pain, in addition to those risk factors we mentioned, diabetes, smoking, hypertension, elderly person, age greater than 55, female postmenopausal, obese. So with this, any chest pain those patients should rush to the hospital and be screened for heart attack. Because heart attack usually happens, patient will experience chest pain, and then the patient will think, or when they go to nearby a clinic, they will assume it's ulcer, peptic ulcer disease, and they will be given some antacids and they'll go home. It actually coming from blockage of one of the arteries of the heart. We see a lot of these cases. A patient will tell you that I'm having a pain, chest pain, or upper abdominal, upper tummy pain, and then they'll go to a particular clinic and they'll be given an antacid, and they'll go back home. Couple of days or couple of hours, they'll be brought to emergency. Actually, it's a heart attack. So if it happens massively, the patient will collapse there and then. And if there is no basic life support and advanced life support at that moment, the patient will ultimately give away, pass away. So chest pain. And then the other things is headache, excessive headache. Any person that experiences headache for the first time, worst headache of his life, should go to the hospital. It's not a stress-related headache. Should go to the hospital and be checked before he continues with routine daily activities. These are the symptoms. And then the other symptoms, sometimes the patient will experience palpitation, awareness of the heartbeat is not normal. Sometimes, normally, you can experience your heartbeat, aware of your heartbeat when you do exertion, when you're anxious. But normally, without anxious, without exertion, it comes up paroxysmally or persistently, then it's abnormal. Such individual should come to the hospital and be checked by a cardiologist.
All right, Doctor, I'm staying with you still. I mean, I know that Madam Abaga here has talked a lot about lifestyle. But for you, if you were to read in your own ranking, what would be, the biggest heart health challenge that we have in Nigeria today? Would you say it is lifestyle that, like she's talked about? Will it be poverty? Will it be policy failure? Or even, lack of awareness?
Thank you very much for this question. Actually, number one is lack of awareness. A lot of majority of individuals in Nigeria, they don't know their health status. High blood pressure does not take anything. You go in and they will check and come out. But majority of individuals, you find them, they have not checked their blood pressure for the past 1 year, or somebody did not check at all completely all his life. So majority of people are not aware, number one. And then number two is policy. Our policies does not encourage actually diet modification, particularly salt. Table salt is very high. She talked about seasoning. Dietitians talk about seasoning. Our seasoning in Nigeria contains a lot of sodium chloride. Some of them up to 3 grams, which actually a needed sodium for the whole day requirement. Sodium requirement for the day is about 2 to 3 grams per day, and then only single seasoning containing that. So we take a lot of salt. Salt is a driver of hypertension in Nigeria and other risk factors. The other risk factors is poverty is one of them. 2, urbanization. Physical, emotional stress, because it has been observed that those in rural areas have lower blood pressure, lower prevalence of hypertension than those that are in urban area. So urbanization is one risk factor of hypertension. So the most, these are the 3 key things, key factors that contribute to cardiovascular disease. Thank you.
And doctor, you just mentioned emotional stress, and what hits me is, can a heartbreak cause a heart attack? I mean, in the sense of, if you're having issues emotionally, maybe with your partner or whatever, how does it impact on your health? Does it really have an impact?
Yes, it does have an impact on your health, particularly cardiovascular health. Emotional stress, there is what we call octopus pot heart, which is in Japanese called Takotsubo cardiomyopathy. When somebody is exposed to emotional stress suddenly, the patient may collapse. The heart will balloon as if it's like an octopus pot. So it's one factor. Another factor is emotional stress can lead to increased heart rate and then subsequently lead to hypertension and even heart attack, because it's a risk factor actually.
Notes.
I will. And back in the studio, let me get back to Sarah Bagai. Now, is the level of awareness of Nigerians when it comes to diet a factor in all of this? Because if you become aware, oh, you know that you have to do regular exercises, you know that you don't have to take a lot of salt, you know that you don't have to take a lot of seasoning, or you watch the type you take and all of that. Could that be a factor in all of this?
You know, in Nigeria, the fact still remains, as the doctor said, that there is a lot of, ignorance. People are not aware of certain basic issues about lifestyle, healthy lifestyle. And, except for media like this, to be able to talk to the public, or, people don't read books, people don't read newspapers in this country. People may listen to radio, they may watch television, so this become the viable media to reach out to people.
But people are even more interested in politics. You see them chair a lot of politics. Nobody wants to listen to health
So
talk.
that further complicates our condition and situation in the country. The truth of the matter is that unless a person comes to the hospital and they are now referred to the dietitian, then, it is difficult for such a person to really be properly aware about, what they should do as healthy lifestyle. So, but you find also that in this country, up to this moment, even the government itself doesn't do much to encourage the practice of dietetics in the country. The nutritionists that we have in the country, most of the work they do is community-based in the area of malnutrition and the rest of them. You understand? So, if only this government, our government in the country, will actually pay attention to the issue of, nutrition education, employing people in the hospital, because you go to some hospitals, you don't even find a nutritionist. Who are the people that will give some basic nutrition education in such hospitals? Maybe nurses, not the professionals themselves. So there are few professionals, even in the healthcare facilities, because the government doesn't, think it is very important. And actually what is even happening, especially in FCT right now, is that people employ just anyone that read food something, food science, food technology, and they send them to hospitals. Those are people who were trained in process engineering, who should go to food industries. They don't have the background of clinical nutrition to be able to educate people about, safe and healthy lifestyle. So that is the problem we are grappling with here in even FCT right now.
But are the professionals available the same way I'm
They
going
are.
to ask?
They
if
are.
The foods,
Yes.
the right foods are available, because many assume that when you eat local, you are eating right. But is that always the case? What is the availability level of the right foods? When you say, okay, don't eat rice, don't eat too much of rice, don't eat too much of yam, what is left?
There is a lot left, because when we are now talking about, plant-based foods, have you brought in vegetables?
Every day?
Yes,
Every meal?
But you're talking
day.
about vegetables. We're beginning to see vegetables that do not, how do they call it? I mean, vegetables that remain firm for days.
What we are talking about now
Are
is
they still healthy?
nutritionists will educate people about home gardening, backyard gardening. These days you find that you could use crates to farm vegetables in your courtyard. You could use sacks, you could use, old tires to farm vegetables so that you don't have to go buying virtually every vegetable. There are some, of course, that you will buy from the market. We are emphasizing being able to do some of these things because we know the value. You understand? There are vegetables now that we can plant, and you find that they can serve the entire neighborhood. There's one particular green vegetable they call hospital tufa. You find that if you plant it, it grows so well that the entire neighborhood could come, take from there. You don't add anything to it.
All right, many thanks, madam. We'll get back to you. It's important to mention that we have another guest joining us via Zoom, Professor Austin Odili, President, Cardiac Society of Nigeria. Many thanks for joining us, Prof.
Thank you very much.
Hear from you. I mean, so much has been said already by the doctor who joins us from Maiduguri and Madam Sarah Abagai about heart health. But I'd like to know your position about heart health in Nigeria. Is it a major concern? I mean, when you talk about diabetes, you talk about cancer, a lot of people focus attention, but not really on heart. Do we have a crisis on our hands?
Yes. It's really of concern. The incidence of heart diseases is growing, rapidly in our country. Barely 4 or 5 years ago, we did a nationwide survey for hypertension, and we discovered that almost like 4 in 10 adults, Nigerians, are hypertensive. In the same vein, heart failure is also increasing, and other risk factors, for example, diabetes, is also on the increase. So one is really worried about the rising incidence of cardiac diseases in our country. Thank you very much.
All right, let me stay with you, Professor Odili. Now, a lot has been said about, lifestyle choices, but I want to ask if there are systemic reforms that could dramatically change the outlook of cardiovascular care in Nigeria.
Thank you. A lot of systemic reforms can help. Let's start with, for example, the way our roads are constructed. If you construct roads and you make provisions for walkways where people can take a walk around their neighborhood, it can help a great deal. So that a lot of people who may want to take a walk around their neighborhood are not doing so because they cannot, the place is not adequate or conducive for them to take a walk. A lot of people also may want to use bicycle within the neighborhood, but the question is, how good is the road, or are the roads around to support cycling? So you discover that these two things they have nothing to do with hospital. They have nothing to do with the health sector. But then it's necessary that these things are done to be able to get the ability, the fact that people need to take a walk around, is quite key. So my colleague was talking about vegetable, which is key. You see, if we have a system whereby, people are encouraged, no matter how small the land in your area is, to plant in, small vegetable, so that vegetable can be used. You want to cook, you just go to get, you can even plant in bags. Even those who are giving seeds can do so, and then use that to reduce the calories they are taking. Again, you see that this has nothing to do with the hospital. Then we talk about even other agricultural processes. Do we have a system whereby the vegetables, can be stored, or fruits that are brought in from very far away, the hinterlands, can they be stored so that by the time they get to the cities, they will still be, fresh for people to eat? Some time ago, we started a campaign that we call Beauty and Health, that even people who are living in urban areas, in cities, you come to some estates in Abuja here, you see that along the pathways you have, trees planted. But we have met argument repeatedly that within the same place where you plant trees, you can actually plant fruits, fruit-bearing trees, that edible fruits that you can equally eat. And at the same time, they also serve as shade and also serve as ornament for the environment. If you come to my house now, the frontage of my house is full of, coconut tree, you have mango tree, you have, there is a vegetable we call oha that we use to cook soup. That is what I have in front of my house. But if you compare it with the trees around the estate, you find out that many trees are in the estate, but many of them are not edible. So these are all systemic things that could be done to improve heart health. I also want to talk about one that we are really introducing, we have been introducing in the past 2 years. If people eventually have heart disease and then they have sudden death, there is need to put in within the system, people who should be able to resuscitate them. We have seen people slumping and dying because help does not come, their way. But if the members of the public are trained on how to do cardiopulmonary resuscitation, which Nigerian Cardiac Society is spearheading at this moment, we want to train all Nigerians at all walks of life how to resuscitate someone who slumps, someone who has any of these heart diseases we mentioned, and then the person slumps, suddenly on the street. Then a bystander can easily resuscitate the person doing what we call cardiopulmonary resuscitation. We are, training people now, all Nigerians, to do that. There is also public access defibrillator. Another thing you can equally provide in the environment that you can use to shock someone who slumps suddenly. That can also help. So we've taken it from the preventive arm, getting to even when these complications have set in, all we are trying to do is let those complications not set in. But even when those complications have set in and somebody, because of those complications, slumps suddenly, it could be, the person could be in a supermarket, it could be in a church or a mosque or a train station or a motor park. The bystanders, the people there, should be able to know how to do cardiopulmonary resuscitation and resuscitate that person even before he is taken to the nearest hospital. We are also spearheading this, and we are calling on government to look at this system and support our effort to be able to even save, a lot of people who succumb to complications of cardiovascular diseases. And with these activities, they may not necessarily die immediately. They may be able to get up and then get to where they will get help, along the line. I have carefully left the hospital setting, and talking about the things that could be done to prevent complications, the things that could be done even in the communities when these complications has caused a sudden death, what could be done. The discussion about the hospital setting is a different ballgame, but I think this is to stimulate the public and stimulate government on what to do at these both ends. Thank you very much.
What is your Strategy. It's okay that the society is spearheading this, like you have put it. But what is your strategy? Are you going from home to home? Are you going from office to office? Are you going on the streets? What's your strategy? Because if it's not effective, then it's not going to achieve the results that you seek.
Okay, thank you very much. Our strategies are many. What we are doing this morning is one of the strategies, and I thank NTA for keying into this and inviting us to be part of this. This is one. Many of our members have been, guests at NTA, stressing this, fact. We have also made a provision that at, different social places where you have a lot of a large gathering of people, we have provided what we call Know Your Numbers campaign. Right now, in about 3 states in Nigeria, Nigerian Cadet Society is, spearheading a campaign we call Know Your Numbers campaign, where we go to shopping malls, busy shopping malls. We go to, for example, Federal Secretariat here in Abuja, even banks in UBA, Gwagwalada, and a few other UBA branches. We have our stand where we measure people's blood pressure when they come, to the bank. We are also using the churches and the mosque to, educate people. The training we have talked about, we are also, for example, on World Heart Day, which was on Monday, we were at National Assembly. We trained the health workers in National Assembly, and on 16th of October, we'll go back to National Assembly again to train not just the health workers, but all the people, the security men, and those people who are in National Assembly, because National Assembly is a place that has high volume of people coming in, day out, for one activity or the other. So we will be on 16th of October, which is World Restart a Heart Day, we will be training members of public and National Assembly. We also hope to train at the Federal Secretariat, which is also a place where you have a large volume of people. This program was launched last year on October 16th during on World Restart a Heart Day, and we launched it at National Open University, the headquarters in Jabi. That was also a strategy because we felt that National Open University has network of all universities or institutions in this country, and we want to use that strategy to be sure that with their framework we will get all around the country. On the World Restart a Heart Day, we will also be doing some training for the members of the public at University of Abuja. So these are the things that we are doing in Abuja here, and likewise our members all over the country will be picking some of these public places. I mentioned this one because I'm in Abuja here, and I'm leading the movements and the drills and the training around these public places in Abuja. However, our members all around the country are also expected to choose any of these high volume public places in their states to provide some of these services, which includes both public education, measurement of people's blood pressure, and training members of the public on how to do CPR. And I want to call on NTA. The other day I was at NTA. I told the NTA staff that I believe even members of staff of NTA also needs this training, because NTA also has large volume of people coming in for one program or the other. So I hope that even Nigerian Television Authority will take up this beyond educating all Nigerians. We'll also have this thing done at your premises. Thank you very much.
So, Professor Odili, not just NTA staff, I think every Nigerian, should get some of this training and skills, especially those who live in the hinterlands, in the riverine areas, in the hard to reach areas. I mean, all of this would go a long way to save lives. Many thanks for your contribution, Professor Odile. The conversation continues, but we'll take a break now. When we come back, I would read some of the comments we have from our viewers, and of course, our guests will respond. All right, many thanks for remaining tuned. It's still Good Morning Nigeria, live on the network service of the NTA. And this morning, our focus is on heart health. Don't miss a bit. So we expect you to stay with us and not miss a bit of the program. Our guests are still very much with us. We'll quickly run through some of the messages that we have already. I have one coming from Alhaji Husseini, who says that we now use polythene and poly products for storage. In the past, what we used were jute bags, which are pathogenically safe and moisture friendly. And he says, that's my quick observation on the deterioration of stored products and the use of chemicals these days. Many thanks for that input. Other messages we have here. This one says, Jack Abba from Akodi, heart is one of the most important parts of our body prone to diseases that looks like a time bomb waiting to explode without notice any time. One, what are the top 3 lifestyle changes you want to recommend to prevent heart disease? What are some common signs and symptoms of heart diseases that people should be aware of? And what are the most significant risk factors that people often overlook? Some of these questions have been, handled by our guests, if you have been following the conversation. But of course, they will touch a bit on it. Other comments here. This one says, Good morning, Nigeria. Another rapid, ugly health challenge is blood pressure and diabetes. A major attention should be given in this regard. That's coming from Jesse from Delta State. Of course, we've had programs here on diabetes and other health conditions. Another one says heart health education should be introduced in primary and secondary schools to catch them young in heart management. How can doctors bridge the gap between traditional and modern ways of heart treatment? That's from Ambassador Caleb Lamero from Plateau in Gindiri. This one says, health practitioners always talk about high blood pressure. What about low blood pressure? Please, I have low blood pressure and also a sugar patient. Can it affect my heart? Doctors, that's coming from Subaru Hassan. Another one says, Good morning, doctor. I'm 55 years old and I'm in love with jogging right from my youthful age. I still want to continue the hobby. What advice would you give concerning heart health? Andrew Abba sent that. Another one says, okay, I think that's the much I can take. Victor, let's see.
I think we should take some responses because of the length of the messages that will come to mind. Perhaps we begin with Dr. Galtimari, if you'd like to respond to some of the messages that have come in.
Yeah, thank you. Thank you very much for the questions. If I can remember, somebody asked about how about low blood pressure, and I'm a sugar patient. Low blood pressure usually, most commonly, it's not most commonly seen, but there are certain conditions that bring about low blood pressure. Low blood pressure means when the blood pressure is less than 90/60. Okay, and that definition is very vital and important because most people assume that low blood pressure is when it is less than 120/80. So if you're having a very low blood pressure, less than 90/60, or tending towards 90/60 downwards, then you need to go to the hospital and be checked. There are conditions that bring about them. And then this is another question. Somebody says he is in love. He was in love of jogging when he was young. Now I should advise him. He should continue jogging, even though I don't know his age, but he should continue jogging if there is no osteoarthritis, no knee pains, no back pains. But however, if the age is above 60 or so, he can do a brisk walk for 30 minutes in the most most days of the week, 4 to 5 days in a week, is very vital in treating hypertension as well as in preventing hypertension and other cardiovascular disease as well. This is much I can remember. Any other one that I will be reminded so that I can attempt to answer them.
Let me take the messages from my end. Perhaps we'll just take notes. What is responsible for my body vibrating sometimes and heavy breath, please? Is it a sign of heart problem? That's from Olufemi Ekosomi. I don't know what it means by vibrating, really. But from Nandam Wiep in Jos, thank you for the enlightenment, he says. How can governments curtail the use of calcium carbide for fruit ripening? What is the 7-second trick to prevent heart attack? Which fruits and what drink cleans the heart? Which sleeping position is good for the heart? That's from Nandam Wiep in Jos. And this one reads, cardiovascular diseases can be caused by lifestyle and negative thinking, stress and overambition to get this or that, which disappointment can cause hypertension, heart attack, stress, or even death. Talk to us about it, he says. That's from Charles Ikechukwu Abiagom from Aniocha, North LGA of Delta State. And many thanks to NTA for this program on heart health. There's high rate of ignorance of heart health status. This is a comment from Iwagulite Chibugu. And this one reads, good morning. Please, what kind of tests can be done for someone who experiences a racing or fluttering heartbeat during exercise, which eases after stopping, sometimes with chest tightness or heaviness? Several ECGs have shown no abnormalities. What is your suggestion? There's no name, but this is it. Perhaps we get to Professor Augustine Odili to respond to some of these questions, if you may.
Okay, thank you very much for asking my opinion. And again, it also shows that the Nigerians are really quite interested in heart health. Someone asked a question about whether diabetes can affect the heart. Yes, it's true. The commonest killer of diabetic patients is actually related to the heart. So those who have diabetes, even when they are not hypertensive or have anything that is commonly known as the traditional risk factors, are prone to a lot of other diseases that affect the heart. So diabetic patients should also know that they are also prone to a lot of heart diseases. Then I think someone was also trying to find out about the symptoms of heart disease. The symptoms are, the first thing to know is that many of these heart diseases are called silent killer. You will not have any symptom while the disease keeps progressing until it happens in a bit of a sudden manner. And so that is why we always advise that you don't need symptoms to check your heart. Simple things like checking your blood pressure, checking your blood sugar, and then ECG, make good to reveal that somebody has a problem with his or her heart, and management could start early enough. Then I think someone was worried about what he calls over-ambition or stress. Yes, like I always mention whenever I'm doing public health education, stress is a common thing in the environment, but it is how you react to stress. Two people may have the same problem. While to Mr. A is stress, but Mr. B, it is not stress. It is how you react to ambitions, how you react to issues of life that determine whether those things are stress, for you or not. And my advice is that yes, we should take it easy. And part of what we have also noticed is that we are exposing children to a lot of stress. Children who should be going to school, learning, and playing, from maybe a child who is let's say 2 years, 3 years, is being put under a lot of stress to learn some things that ordinarily that child should be able to learn at the age of 5 or 6 years. We thank the Federal Ministry of Education for talking about the policy of making sure that children should get to a particular age before they enter the university. Many parents try to rush their children, and that is adding a lot of stress on those children, and it builds up. The stress builds up over time and causes heightened sympathetic discharge, which is not a very good thing for cardiovascular health. So I think these are the ones I could remember. Thank you very much.
Thanks, Professor Odili. One will be quick to also ask about children who are not in school, who are made to do very stressful work. I mean, those on the farms, those who are asked to, engage in one form of activity or the other. Can that also affect their heart health? But, I want you to talk to us about where we are in terms of treating congenital heart diseases. In the past, we used to hear about reports of people being flown out of the country when they have such conditions. Have we advanced in Nigeria? What really is available when it comes to treatment of heart diseases in Nigeria?
Okay, let me start with your last question. We have advanced remarkably. We just ended our conference, the Pan-African Society of Cardiology with Nigerian Cardiac Society. And part of what we did in that conference was to provide treatment for a very expensive treatment for indigent Nigerians. And we also used that opportunity to improve manpower improve capacity and skills for upcoming cardiologists. We did open heart surgery with the sponsorship of some Nigerians, open heart surgery at Federal Medical Center here, and it was all fully done by Nigerians. And upcoming cardiac surgeons, we are all there to witness those open heart surgeries. We also did what we call interventional cardiology, interventional procedures, what we call percutaneous interventional procedures, where you put, you will not open the heart, yet you walk on the heart, through a wire that will pass through one of the arteries into the heart. We did that for so many patients at Cardiocare Multi-Specialist Hospital here in Abuja. And a lot of the patients are moving around now and happy with their lives. The other preventive aspect is also something that Nigerian Cardiac Society is spearheading. So all aspects of treatment, it's what it's obtainable in Nigeria now, not just in Abuja here, but in many cities in the country. For us in Nigerian Cardiac Society, one of the things we are doing, we are leveraging on this opportunity to ensure that manpower, capacity of those who have anything to do with the heart should be improved. Because of the increased incidence of heart disease, we have noticed a lot of quacks coming in to cause confusion when it comes to heart disease. But as Nigerian Cardiac Society, we are developing the proper framework to ensure that anybody who will have anything to do with heart disease must be an expert whose competence and expertise is well known and is well documented. Then I will quickly talk about the children who do farm work and all that. If those children may be doing those farm work, to them it may even be exercise, and that will be good, especially if the children enjoy it. But when children are kept in very stressful conditions to learn what they are not expected to learn at a particular point in time, it puts undue stress on them. They may be seated in one place, but they are under undue pressure. That even causes more trouble than children who are running around and moving and enjoying what they are doing. What is key is, do we put undue pressure on children? If you, for example, ask that child to go and sell on the streets, if it is undue pressure, maybe you have to put a target that the child should be able to cover this level of sales in a day. That is undue pressure, because at that particular time of development and growth, that child is not expected to do that kind of calculation.
Professor Odele, thank you very much. We've run out of time almost completely, just so that we can take a quick shuttle to Dr. Galtimari for perhaps 30 seconds. Dr. Galtimari, somebody sent in a message and said his body was vibrating. I'm not sure what advice you would have for this person. Perhaps you could sign off on this note.
Thank you very much. Vibration means a lot of symptoms to me as a medical doctor. But if he's having vibration as well as palpitation, awareness of the heartbeat, it's likely that it's coming from the heart, and he should go to nearby cardiologist to be checked. And I would like to mention that maternal health, particularly eclampsia and pre-eclampsia and subsequent peripartum cardiomyopathy in women. Eclampsia kills the most killer of maternal, the most prevalent maternal mortality in this environment, in this country. So, and it can be prevented. Eclampsia or pre-eclampsia is a hypertension while a woman is pregnant at her second trimester or third trimester. And that will lead to, is a very great risk factor for peripartum cardiomyopathy, which is a form of heart failure after delivery or just a month before delivery. And this can be, pre-eclampsia can be prevented if a patient comes to, pregnant woman comes to antenatal and found that she is hypertensive, by giving just...
All right, many thanks, doctor. Because of time, thank you so much for your intervention. We need to round off now. Madam Abagai, in 20 seconds, if it's possible. What does coffee and coconut water do?
Coffee, let me finish answering these questions.
we really do not have much time.
There are fruit issues. Somebody was asking, what fruits would you eat to help the heart? Do you understand? Mm-hmm. So we have a lot of fruits that can be used. You can use, banana, eat banana because of the potassium in it. It will help to support the heart health. Eat apple. Okay. When you eat an apple, because of the pectin, it helps, to emulsify the cholesterol.
All right.
And then watermelon, it helps the lycopene there, that red pigment. We help, to strengthen the walls of the arteries to prevent stroke.
We need to end the conversation now. Thank you.
Diabetic, you can't take all of this.
Yeah,
thank you.
We measure them. We measure them. Coffee, moderation.
And coconut water? Coconut
water for what?
Is it healthy?
Well, for health generally, when you take some of these things, some of them have, benefits, but really we can't bank on them.
Okay. Thank you very much, Sarah Abagai, registered dietitian, nutrition educator, author, and fellow Institute for Dietetics in Nigeria. Many thanks for being our guest. We appreciate you. Professor Augustine Odili, President, Cardiac Society of Nigeria, University of Abuja, Teaching Hospital, Gwagwalada, consultant cardiologist. Many thanks for your insights and for joining us. Dr. Ibrahim Abubakar Gatmari, member, American College of Physicians, and consultant physician cardiologist at UMTH, and also a lecturer at University of Maiduguri. Thank you so much for being our guest. We do sincerely appreciate you. All right, so that's it on Good Morning Nigeria this Friday. Take care of your health. I'm Henry John. Don't touch the dial.
And I'm Victor, as we will see you again on Monday. Have a great weekend.